Dear viewers, I hope you are all fine. This ultrasound video shows scanning of the urinary bladder and a case of vesical growth is visible. You can see the urinary bladder and the mass, semi-solid to solid in consistency with no fluid in its interior. This is the growth, and this mass is attached to the left lateral wall of the urine-filled urinary bladder and the adjacent area of the base of the urinary bladder. An ultrasound scan is used to show if cancer is present, if the mass is present, and how large it is. Ultrasound cannot always find small tumors, so additional tests may be required. Ultrasound scan with the full bladder is mandatory to see all the findings. Now you can see there's significant blood flow is seen in the mass. Tumors can be either benign or cancerous. Bladder cancer or bladder tumors are relatively common, and most bladder tumors are cancerous. One of the basic abdominal organs that are assessed during transabdominal ultrasound examination is the urinary bladder. The bladder must be filled with urine. This is a prerequisite for a reliable assessment, and at the same time, an acoustic window in examining adjacent structures and organs. For example, prostate gland and female genital organs. Sonography enables detection of 95% of exophytic lesions within the urinary bladder with the diameter exceeding 5 mm. Mostly it is carcinoma of the urinary bladder due to its malignant character and the need for aggressive surgical treatment. A correct diagnosis of this disease is essential for the patients, as the lack of adequate treatment and delayed treatment considerably affects the prognosis of this disease. Again, you are seeing the urinary bladder and the mass, and the mass is attached to the left lateral wall of the urine-filled urinary bladder and the adjacent area of the base of the urinary bladder. Now, high-grade bladder cancer is likely to grow and spread quickly and become life-threatening. High-grade cancer often need to be treated with chemotherapy, radiation, or surgery. Low-grade cancers appear non-aggressive and have a low chance of becoming high-grade. Most bladder cancers are diagnosed as an early stage when the cancer is highly treatable, but even early stage bladder cancers can come back after successful treatment. For this purpose and for this reason, people with bladder cancer typically need follow-up tests for years after treatment to look for bladder cancer that reoccurs. Again, you can see the urinary bladder and the mass. Bladder ultrasound can show how much urine the bladder holds when it is full and whether someone completely empties the urinary bladder when urinating, and the residual volume of the urine can be measured, and it will show the incomplete evacuation of the urinary bladder and the extent of the residual volume and the extent of the urinary obstruction. Bladder ultrasound is often done along with the ultrasound of the kidneys. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.